Umuganga, a consultant pediatrician, pediatric emergency subspecialist, working at Baho International Hospital, Kigali, Rwanda. Sleep apnea is a condition that makes a person stop breathing for a few seconds, maybe like 10 seconds during sleep, despite adequate effort of breathing. So the most common cause is called obstructive sleep apnea. This sleep apnea with difficulty of breathing occurred due to airway obstruction. When say airway obstruction, can be partial, halfway, or complete airway obstruction during sleeping. Obstructive sleep apnea are common in children from 1% to 5% of all ages. It can occur at any age, but the most peak age of occurrence is from 2 years up to 6 years. When you see the cause of obstructive sleep apnea, there are lists of causes of obstructive sleep apnea. The first is enlargement of the adenoid and tonsil. We call it adenotonsillar hypertrophy. The second is allergy of the nose that cause obstruction in the nose, that can cause obstructive sleep apnea during sleep. The third cause is in adolescents and older children, obesity. Obese children could have obstructive sleep apnea. The fourth cause, anatomical abnormality of the face that can affect the airway, can result in sleep apnea at night. And the fifth cause is when a nerve condition or muscle condition that affect disease that affect the airway can cause obstructive sleep apnea. But the most common cause in children, especially from 2 years to 6 years, is enlargement of the adenoid and or the tonsils. So when you say enlargement of adenoid and tonsils, the adenoids and tonsils can enlarge. These are the tonsils are lymphoid tissues at the back of the mouth, the throat, and adenoids are also round lymphoid tissues at the back of the nose, higher up in the throat. They are normally present in children, but they can be enlarged due to exposure to different allergen or repeated infection. So when they enlarge, they can obstruct the airway passage and cause obstruction during sleeping. That's why it causes obstructive sleep apnea during sleeping, which is the most common cause. So when children have obstructive sleep apnea, the symptoms divide into three. The first is the nighttime symptom, usually noticed most commonly. The second, daytime symptoms. The third is the consequence. When you say the nighttime symptoms, they usually have snoring. Snoring is the hallmark of obstructive sleep apnea. Not all children with snoring have obstructive sleep apnea, but almost all children with obstructive sleep apnea have snoring, almost all. Other symptoms are like nighttime frequent awakening because of the difficulty of breathing, and then the pause during breathing, followed by a gasping type of breathing, and they awaken from their sleep, which is more frequent at night. And they usually breathe with mouth open because the airway obstructed. You have to breathe with mouth open during sleeping to make the airway patent. They could have also irritability, like difficulty of sleeping, moving around the bed. Sometimes they can pass urine during night without awareness, or they can be awoken for frequent urination. During the daytime, because of difficulty of sleeping and difficulty of breathing at night, during the daytime, they will have commonly headache. They suffer from headache, especially in the morning. They can have chronic mouth breathing and dryness of the mouth and excessive sleepiness, even at school. They can suffer from this, and usually they will have failure to weight gain or poor weight gain or growth. The consequence of which would be they could have memory loss, and they could have behavioral abnormality, and they can have also irritability, lack of attention at school, and poor performance at school. And also, if not treated timely, it can result in abnormality or disease in the lung and the chest. So this is a consequence that we encounter in obstructive sleep apnea. The diagnosis usually made clinically. It is based on all the symptoms. The doctor can easily diagnose obstructive sleep apnea, especially if the child has two of the following, most likely suffering from obstructive sleep apnea. The first is snoring during sleeping. The second is difficulty breathing with or without pause in breathing during sleeping. The third is daytime sleepiness, irritability, behavioral change, or learning problem. Probably he's suffering from obstructive apnea clinically, can be diagnosed. Other possible method of diagnosis, we usually have also X-ray for diagnosis of adenoid enlargement, neck X-ray. There is so-called also sleep test to diagnose obstructive apnea, but commonly clinically diagnosed and to checking the enlargement of the tonsils by opening the mouth, and we have lateral X-ray of the neck to check enlargement of the adenoid. Well, once diagnosis is made, the management, there are two options for management. The first is medical, the second is surgical. When we say medical management, we use medicines for a child having allergic rhinitis, allergy of the nose, asthma that can contribute for obstructive apnea to be treated adequately with medicines of sprays to the nose or nasal decongestants or treatment of asthma also. If there is infection, the infection has to be treated, but the mainstay of management and definitive one is surgical management for adenotonsillar hypertrophy. So when the tonsils and or the adenoids are enlarged, the definitive management is removing these tonsils and adenoids. We call it tonsillectomy. So removing this can cure almost 100%, and removing adenoid tonsils usually doesn't result in significant immune deficiency. So there is no major risk of immune deficiency after removing. If the patient is suffering from obstructive apnea due to adenotonsillar hypertrophy, tonsillectomy or with or without adenoidectomy should be done. The first thing what the parents has to do for a child having obstructive apnea, if the symptoms are noticed, they should bring to pediatrician or ANT doctor, ANT specialist dealing with the ear, nose, throat, to evaluate the child. And there are 4 things they need to help the child at home. The first is helping their children by making home smoke-free. Making home free from smoke, any form of smoke, that helps the child decrease aggravation of this obstructive apnea during sleep. The second is if the child has asthma or allergic rhinitis, they need to help getting the treatment of this condition by bringing to the health specialist. The third is for obese children, they need to help decrease the weight of their child so that the obstructive sleep apnea can reduce. The other thing is helping them not to sleep by their back flat and avoiding supine position. When these children having obstructive apnea, if they sleep with their back supine, the obstruction is more severe. Because the reason why sleep apnea or difficulty breathing with pause in breathing during the night during sleeping is, during sleeping the airway collapse and the breath center of the brain usually does not respond fast for decreased oxygenation, so that they can have difficulty breathing followed by pause in breathing, followed by awakening from their sleep. So recommended to sleep either lateral position or with a pillow under the neck. This is all, but I need to advise for parents, if the parents their children suffering from snoring at night with difficulty of breathing and frequent awakening from sleep, they have to bring to health professional to evaluate for obstructive sleep apnea and get treatment timely before consequences appear. Thank you so much.